Okay, I'm going to do my examination on a bird now. I already submitted it last time with the x-rays, and you said that if we already did it to give you the dates. So I'll email you the dates on when I did it, but I'm just going to reiterate. For all patients, when we do a physical examination, we get their heartbeat, their respiratory rate, we check their eyes, their ears, their nose, make sure there's no discharge. We listen to hear if we hear like a heart murmur or like any fluid in the chest or the abdomen. You check to make sure they're neutered or spayed. You can do, obviously, you can just feel back there. You palpate their abdomen to make sure you don't feel lumps, bumps. Obviously, you look at their coats and to make sure they don't have any skin conditions, any hot spots. You look in between their paws. It depends also the complaint while they're here. Why are they here? Or the reason they're here. So obviously, if it's coughing, then you obviously would pay really close attention to his heart, his respiratory rate, to see if there's any discharge, if it's distemper, or if in a bird's case, or a rabbit or a rat or whatever, you just you'll take obviously a closer look on that. X-rays obviously would be beneficiary, but just making sure the mucous membrane is all normal. The capillary refill time, CRT, is normal. 1 second is pretty normal. 2 seconds is questionable. Anything over that is alarming to get the doctor. So I already did the bird thing, but I'll just do it again on a stuffed animal. And basically, like if it's a trained bird like the one that I had, he just jumped right onto my hand, and I just like held his feet, with little webbed feet, with my finger, and he was totally fine with me doing the examination like that. And basically, I just took his heart rate, and it was a parakeet. And their heart rate ranges depending on obviously their breed, their size, and their stress level. So if they are calm, it's better to just get them, not to towel them. Like if they're unruly, what you could do is you can towel them, hold their whole body, and then you kind of put your thumb and your finger around their neck, not so tight, but just so they can't turn around and bite you, because they won't. But obviously their blood pressure is going to rise, their heartbeat's going to rise, obviously, and you're going to get an inaccurate reading. So to have them very calm and have them just jump on your hands and hold their legs, their feet, and go ahead and get their heart rate. And again, it depends. Usually it's like 220. You just get the heart rate, and then for 15 seconds, and you multiply it by 4, and that's how you get your reading. I mean, and again, with birds, it depends on their breed, like 220 to 600 meters per minute. It depends on their breed. For a parakeet, that's like a year old, for like their respiratory rate is like 23 to 35 breaths per minute, and their temperature is 103 to 108. So they do run a higher temperature. So obviously I would examine the ears with like an otoscope, or not on a bird, like on a rat and a mouse. But in a bird, so what you do is you look at their eyes and look at their skin to make sure they don't have any mites in their feathers, to make sure they're not biting at their feathers, and stuff like that. Okay, and that's it with the bird, and I'll email you the dates, because I did it already. And then with the rat, it's the same thing, and the mouse, just checking, and the rabbit as well, just when you're getting their heartbeat, to check their heartbeat at their chest, check their respiratory rate on the side, usually in the abdomen. You can listen in the abdomen, make sure there's no fluid all around on each side, and then obviously checking in their ears, checking their eyes to make sure they're white, looking in their mouth. Usually the mouse and rat's teeth are yellow. They rarely need a teeth cleaning. Paws, their skin especially, to make sure they don't have any skin conditions, because they can get that, and it's easily transmitted as well, like mites. And their tail, obviously, for any wounds. Sometimes they do fight, depending if there's like a female present. And then with, that's with rats and mice, and rabbits the same way. Okay.
Thanks.